Good morning, everyone, and welcome to today's webinar hosted by PYA. Today, we are continuing our timely, tough, or tricky physician compensation and fair market value topics series with a presentation on the proposed 2023 Medicare Physician Fee Schedule. PYA is happy to present today's webinar on this important topic. You will have the opportunity to submit questions to today's presenters by typing a message into the question pane of the control panel. We'll collect these and address them by email after the webinar. All of our webinars are recorded and released with a copy of the slides after the event. With that, I would like to introduce Lyle Oelrich, Principal, and Katie Taylor, Senior Manager at PYA.
Thank you, Laura. Again, my name is Katie Taylor, and we are very excited to be here with you today as we talk about a very timely subject involving physician compensation and fair market value in 2022. As Laura mentioned, we will be discussing the proposed 2023 Medicare Physician Fee Schedule, but specific to fair market value and physician compensation. However, collectively, PYA's experts have been covering this topic in detail over the last several weeks. In fact, there's a three-part series of webinars dedicated to these proposed changes that I will now ask our moderator to chat out. As a quick reminder, the discussion today will focus on general education topics only, and nothing herein is intended to be definitive on any particular matter or to issue a fair market value or commercial reasonableness opinion, which will be based on a specific set of facts and circumstances. I am happy to be joined today by my colleague, Lyle Oelrich. Lyle is a principal in our Compensation Valuation and Physician Services Department. Lyle is located in our Knoxville office and has over 20 years of experience. He led the development of PYA's compensation valuation and commercial reasonableness practice, where we perform just over 1,200 opinions each year. As for myself, I'm a senior manager in our Knoxville office, and I have over 10 years of experience in compensation valuation. Like Lyle, I'm also a regular presenter and author of numerous compensation valuation topics. If you have attended one or more of these sessions already, we welcome you back. We're glad to have you. If you are joining us for the first time, this webinar is presented as part of a series of timely, tough, or tricky physician compensation and fair market value topics. We've covered many topics over the last few months, a listing of which is presented on this slide. Additionally, I'll ask the moderator to chat in a link to all of these webinars at this time for your reference. In this webinar, we're going to be focusing on the 2023 Medicare Physician Fee Schedule proposed rule. It has several proposed changes, some of which involve physician compensation and fair market value, making it a timely topic in our ongoing webinar series. So over the next few slides, Lyle and I will discuss key proposed Medicare Physician Fee Schedule updates impacting physician compensation and fair market value, and what steps organizations should take now to prepare for the anticipated changes. Most of you have probably seen that CMS has released the calendar year 2023 Medicare Physician Fee Schedule proposed rule that was issued on July 7th, 2022, and that impacts Medicare Part B payments starting January 1st, 2023. Comments were actually due on September 6th, 2022, and we expect the final rule closer to the end of 2022. CMS proposes several payment policy changes, including rebasing and revising the Medicare Economic Index, revaluing remaining evaluation and management codes, continuing its 4-year phase-in of clinical labor pricing updates, and delaying changes to redefine the substantive portion of a time-based split-shared visit until 2024. In addition, CMS includes policies that would impact advanced alternative payment model participants, including substantial changes to Medicare Shared Savings Program and requests for feedback on potentially transitioning to make qualified participant threshold determinations at the clinician rather than the AAPM entity level. So let's dig in. I'm going to be covering 10 key highlights from the Medicare Physician Fee Schedule proposed rule over the next 2 slides, and then I'll hand it over to Lyle to focus on the implications to physician compensation and fair market value. So first up is a 5% pay cut. In 2023, the 2023 conversion factor is currently proposed to be $33.08, which is down from the current conversion factor of $34.61. Last year, in the face of a similar reduction, Congress approved a 3% increase for 2022, which was only intended to help with the continued impact of COVID-19. So we know we would be facing at least a 3% reduction in 2023. The other 1.4% reduction is due to budget neutrality requirements to offset the cost associated with the other proposed changes in the fee schedule. The second item is the appropriate use criteria. Concurrent with the publication of the proposed rule, CMS announced it will indefinitely delay the payment penalty period of the appropriate use criteria program for advanced imaging services. The program, which was set to go into effect January 1st, 2023, requires imaging provider claims to include additional information regarding the ordering physician's consultation with clinical decision support totals. Number 3 is telehealth services. Thanks to congressional action back in March, the waiver of the geographic and location requirements for Medicare telehealth coverage will continue for 151 days following the end of the public health emergency. CMS proposes to continue other public health emergency related regulatory expansions of telehealth coverage for the same time period, which includes, but certainly not limited to, allowing payment for rural health clinics and federally qualified health centers furnishing telehealth services. CMS also proposes to expand the list of Category 3 services for which Medicare telehealth coverage will cover through December 31st, 2023. Number 4, evaluation and management services, and this is what Lyle in part is going to be talking about later in the presentation. CMS proposes to implement CPT changes in coding and documenting for other E&M visits, which include hospital inpatient, hospital outpatient, emergency department, nursing facility, home or residence services, and cognitive impairment assessment. These changes include new descriptor times, revised interpretive guidelines for levels of medical decision-making, choice of medical decision-making or time to select code level, and elimination of the history and exam to determine code level. It is this proposal in particular that we want to talk about further in a few minutes. However, as a preview, proposed work RVU adjustments on other E&M codes range from a negative 48%, which is for a level 1 ED visit, 99281, to a positive 32% for a level 1 subsequent hospital care visit. Considering the negative 4.4% adjustment we referenced earlier to the conversion factor, as well as these E&M changes, many specialties will see a change in total reimbursement. For example, the overall impact to reimbursement is estimated to range from negative 4% for interventional radiology to a positive 5% for infectious disease. Additionally, the proposed rule included potential removal of entire sections of CPT codes for E&M services. For one example, CPT codes 99354 through 99357, which range in work RVU value from 2.33 to 1.71 respectively, may be deleted entirely and replaced with 993X0, which has a work RVU value of 0.81. And this particular topic is covered in detail in one of those presentations I referenced earlier. The last one on this list is split shared visits. CMS is proposing to delay by 1 year the effective date of the split shared visits policy, which was finalized in calendar year 2022 with a few exceptions. For calendar year 2023, clinicians will continue to have a choice of history, physical exam, or medical decision making, or more than half of the total practitioner time spent to define the substantive portion instead of using total time to determine the substantive portion. Some other key highlights from the proposed rule that we wanted to cover as well. The first is the Medicare Shared Savings Program overhaul. CMS proposes several changes to the Medicare Shared Savings Program to increase participation and advance equity, including longer glide paths to downside risk for accountable care organizations. So for example, any Medicare Shared Savings Program ACO presently participating in basic track level A or B can elect to forgo downside risk for the balance of its current agreement period. Beginning in 2024, CMS will offer new ACOs that meet certain criteria the opportunity to receive advanced shared savings payments to fund infrastructure development. CMS also proposes changes to benchmark calculations intended to grow and sustain long-term program participation. Behavioral health services, I know that we've certainly heard a lot about that this year. This is item number 2 on the list. CMS proposes to expand access to behavioral health services by creating an exception to the direct supervision requirement for incident to billing. This change would permit behavioral health services to be furnished by licensed professional counselors, marriage and family therapists, and other types of practitioners under general supervision when these services are incident to the services of a physician or non-physician practitioner. Also, CMS proposes to create a new general behavioral health integration service personally performed by a clinical psychologist or clinical social worker to account for monthly care integration where the mental health services furnished by said clinical psychologist or a clinical social worker are serving as the focal point of care integration. Number 3 is new reimbursement for chronic pain management and treatment services. Beginning in 2023, Medicare would reimburse providers for furnishing a monthly bundle of services, including assessment and monitoring, administration of a validated pain rating scale or tool, the development and maintenance of a person-centered care plan, overall treatment management, coordination of any necessary behavioral health treatment, medication management, pain and health literacy counseling, any necessary chronic pain-related crisis care, and ongoing coordination between relevant practitioners furnishing the care. CMS proposes these services to be personally performed by a physician or a non-physician practitioner, with the first 30 minutes of services reimbursed at approximately $80, with additional reimbursement for each 15-minute increment. Number 4 and number 5 relate to requests for information from CMS. The first is Medicare potentially underutilized services. As part of its broader health equity strategy, CMS is asking stakeholders for ways to improve Medicare beneficiary access to high value, which is defined as services that provide the best possible health outcomes at the lowest possible cost, but potentially underutilized services. CMS list of such services includes preventative services, annual wellness visits, diabetes management training, chronic care management, and behavioral health integration issues. Another request for information is related to the global surgical package valuation. In preparation for future rulemaking, CMS seeks stakeholder input on strategies for paying more accurately for the global surgical packages based on changes in healthcare delivery over the last several years. And with that, I will hand it over to Lyle to discuss our next topic.
Thank you, Katie. While, as you all have seen, there are numerous proposed changes to the 2023 Medicare Physician Fee Schedule, we wanted to prioritize our time together and talk about some of the changes that may impact the greatest number of you all attending today, realizing that we can't talk about everything here, but again, trying to prioritize a few items. And when we did that, as Katie mentioned, we thought about the E&M changes that she highlighted a few minutes ago. In fact, in a lot of ways, as a physician compensation expert, many of the proposed changes, particularly the E&M changes, remind us of the work RVU changes we experienced with CMS's implementation of the 2021 Medicare Physician Fee Schedule. Yet in 2021, many of the proposed E&M changes were on the outpatient side, such as large increases in the work RVUs associated with established office visits this time in 2023, many of the proposed E&M changes will impact those specialties who generally work in the inpatient setting. So let's dig in a little bit further and talk about some of the implications of the E&M changes specific to physician compensation and fair market value. To start, what are more of the changes that CMS is proposing? You can see here a non-exhaustive list of some of the more notable work RVU changes on this slide. For example, initial hospital care work RVUs are generally declining, while subsequent hospital care work RVUs are increasing fairly significantly. Most of the other changes, as you'll see, are on the inpatient or facility side. Of course, recall as well, there is a proposed decrease in the conversion factor that Katie mentioned a few minutes ago, which will ultimately impact the reimbursement by Medicare for these CPT codes and commercial contracts as well, if those contracts are paid as a percentage of Medicare. So on this slide, here you'll find the biggest winners and losers relative to total allowed Medicare charges by specialty. And to be on this list and to just narrow it a little bit, we included only those allowed charges that are expected to change by plus or minus 2%. However, what's not on this slide, but important to this conversation, is the aggregate impact by specialty of the work RVU changes we discussed. Some of the greatest impacts, meaning greatest increases in work RVUs, are expected to come in infectious disease, geriatrics, internal medicine, and physical medicine. But again, here to be on this CMS work RVU list that I just referenced, work RVUs are expected to increase by 2% or more. Now, all that said, what may be underestimated in this work RVU impact calculation that was performed by CMS is the recognition that certain specialties that have not yet been recognized by CMS for reporting these statistics roll up into other specialties. So for example, one specialty that comes to mind in these circumstances in particular is hospitalist medicine. Currently, hospitalists roll up under internal medicine for CMS's specialty categorization. However, with the CPT code changes we identified on the prior page, we would not be surprised to see greater growth in hospitalist medicine work RVUs than what CMS generally expects to see for internal medicine work RVUs. And in my mind, this will certainly be an area to keep an eye on as we move forward. So what do these proposed changes mean for physician compensation and fair market value? First, while many hospital-based specialties have moved away from a work RVU-based compensation model, for those that still have a work RVU productivity model, without any mitigating changes to that model, we would expect to see a change in physician compensation, perhaps without any corresponding change in a physician's work effort. And along with these physician compensation changes, we may also see a change in the losses for certain specialties when these physicians are employed. So that said, but maybe from a different angle, without any physician compensation adjustments, physicians in certain specialties who primarily bill E&M codes, again, generally on the inpatient side, and are on a work RVU productivity model with a work RVU threshold, may meet that threshold faster, thus earning additional compensation for which they were ineligible for historically. In comparison, and generally speaking, physicians in the same specialty but not on a work RVU productivity model will typically experience around a 1 to 3% increase in compensation per year, all other factors besides productivity being the same. Third, keep in mind that physician compensation benchmark surveys, when they become available in 2023, will generally be based on 2022 data. For this reason, where contractually permissible, certain hospitals are considering the use of work RVU values in the 2022 Medicare Physician Fee Schedule to compensate physicians on a work RVU productivity compensation model in 2023. And for those that have not yet implemented the 2021 Medicare Physician Fee Schedule, so they're on the 2020 or earlier, the proposed 2023 changes may bring in another dynamic that has not, but should be considered before the 2021 or later Medicare Physician Fee Schedule is implemented for calculating physician work RVU productivity. And of course, it's important to keep all of these proposed changes in perspective. An assessment of fair market value is not just based off of benchmark data. There are many other factors such as payer mix, local market dynamics, and others that need to be reviewed as a part of this process. So what should you be doing to prepare for the anticipated changes? These changes, as well as others that Katie mentioned in the Medicare Physician Fee Schedule, have the potential to create compliance issues or be costly for hospitals and health systems that employ physicians. So the first thing everyone needs to be doing is to evaluate what these proposed changes look like for their respective organizations. And having seen several of these analyses where physician compensation was calculated using the 2023 versus 2022 Medicare Physician Fee Schedule, there are certainly a few items to be on the lookout for that might have fair market value and/or commercial reasonableness implications. So as one example, with no change to the current physician compensation methodology and by using the 2023 versus 2022 Medicare Physician Fee Schedule to calculate work RVUs, one employer was projected to incur an incremental loss per physician on several inpatient-oriented specialties over the losses they experienced in 2022, which was going to be challenging from a commercial reasonableness perspective. Of course, some of those physicians, as I mentioned earlier, that are on a salary or are hospital-based specialties that work shifts may not have any change to their compensation, but could still see a decline in reimbursement. On the other hand, for those physicians whose compensation is work RVU based and the physicians themselves were already highly productive before the proposed changes in 2023, an analysis may, in fact, potentially project significant changes in physician compensation without any changes in physician work effort, because the work RVUs for the same CPT codes used before implementing the 2023 Medicare Physician Fee Schedule are now increasing. And of course, when this occurs, it's really important to take some time to evaluate or potentially reevaluate fair market value and commercial reasonableness. So what are some tactics to consider if fair market value or commercial reasonableness issues arise when measuring the impact to your organization of implementing the proposed 2023 Medicare Physician Fee Schedule? First, I think it's important to point that we still have some hospital and health system clients that have not implemented a Medicare Physician Fee Schedule beyond 2020. Since the 2021 Medicare Physician Fee Schedule brought significant E&M changes, as I mentioned earlier, that could impact worked RVU compensation models. And we expect some of those organizations to continue to hold on to the 2020 Medicare Physician Fee Schedule as we enter 2023, so that they can better track how using the 2023 Medicare Physician Fee Schedule will impact physician compensation and overall financial performance. Now, if you find yourself in this situation where you want to maintain the use of the 2020 Medicare Physician Fee Schedule, or even the 2021 or 2022, if those have already been implemented, it's important to begin really a comprehensive physician educational program and potentially share data with your physicians regarding the financial impact that the new Medicare Physician Fee Schedule will have on your respective organization. Certainly, in short, you don't want to be surprising anybody by changing or not changing to the 2023 Medicare Physician Fee Schedule. So, but all that being said, we are aware, as many of you are, I'm sure as well, that some employment agreements contractually require the use of the most recent Medicare fee schedule. For this reason, a hospital or a health system may not have a choice whether to pay the physicians using the work RVUs in the 2022 versus the 2023 Medicare Physician Fee Schedule. So if you find yourself in this situation, it may be helpful to perform an impact analysis, as we described earlier, and then reevaluate fair market value and commercial reasonableness for physicians who stand to have changes, and in some instances, potentially a material change in their compensation. And for those physicians whose fair market value and commercial reasonableness analysis identify a potential problem, our clients have generally been addressing this subject by using one of three tactics. First, changing the compensation per work RVU conversion factor in the physician's current employment agreement, with the results similar to those that have previously been described. 2023 physician work RVUs may increase more than 2023 physician collections. So when this occurs, the physicians may need a decrease in compensation per work RVU compared to prior periods. Second, you may want to consider changing the work RVU threshold in a physician's contract where one exists. Some hospital employed physicians are on a base salary plus productivity model when they meet a certain work RVU threshold, and with several CPT codes experiencing an increase in work RVUs under the 2023 Medicare Physician Fee Schedule, some physicians are likely to meet their productivity threshold faster, thus earning additional compensation for which they were ineligible in prior years. In that case, some clients are considering an increase in the work RVU threshold associated with the current physician compensation formula to mitigate the impact of implementing the 2023 fee schedule in their compensation formula. And of course, as a third option, or option C, you can consider both adjusting the compensation per work RVU and threshold to potentially mitigate some of the fair market value or commercial reasonableness issues that may have arisen. I do want to point out, though, one thing that's really important in this slide, even though we just mentioned three tactics, with all this being said, it's really important to remember that any compensation formula, such as a compensation per work RVU with a threshold and a conversion factor, is a means to an end. And that end is the total amount of compensation that's paid to a physician. So when you do that, and including changes from the 2023 Medicare Physician Fee Schedule, along with all other factors that influence physician compensation, the total compensation paid to each physician should, remember as well, be at fair market value, commercially reasonable, and not take into consideration the volume or value of referrals. So as we leave you today, remember that now is the time to think about what these potential changes to the Medicare Physician Fee Schedule may mean for your organization. And in doing so, your organization should strategically plan for the financial impact and not be surprised by any contractual or other physician compensation changes that may need to be occurring now to remain compliant with fair market value and commercial reasonableness requirements. And as always, we will continue to monitor this subject, including any potential end-of-year legislative changes, and provide additional thought leadership as that information becomes available. So thank you for your time today, and I'll turn it back over to Laura to wrap things up.
Thank you. And thanks to our presenters, Lyle and Katie. If you have any questions, their presentation and contact information will be emailed to you, along with a recording of today's webinar. Also, if PYA can provide assistance with audit, tax, compliance, valuation, or physician services, call or email us. You may also visit our website at pyapc.com for more details about our specific areas of expertise or to subscribe to receive PYA insights. On behalf of PYA, thank you for joining us and have a great rest of your day.